There are several studies of broad-spectrum micronutrients for the treatment of ADHD, which we're about to discuss. But before we do that, let's review conventional treatment for ADHD. 9.4% of children in the U.S. have been diagnosed with ADHD. As we know, standard treatments include stimulant medication and behavioral therapy. At least 23% of children receive neither treatment, unfortunately. The MTA, or Multimodal Treatment of ADHD study, was a multi-site study of nearly 600 children designated to evaluate the leading treatments for ADHD. Participants were randomly assigned to one of 4 treatment modes. In the MTA study, the percent of children who met the study definition of successfully treated were as follows: 56% in the medication management group, 34% in the behavioral therapy group, and 68% in the combined group. Now, some families prefer to use non-standard treatments. The estimated use of complementary and alternative therapies to treat ADHD symptoms by families is between 12 to 68%, depending on the study. And when surveyed, about 87% of pediatricians reported that they had been asked about complementary alternative medicine by a patient or parent in the prior 3 months. However, fewer than 5% of pediatricians reported that they felt very knowledgeable about complementary and alternative therapies. Although many children respond to the standard treatments of stimulants and behavioral therapy, approximately 1/3 are still symptomatic even after these treatments. The other concern that I'm sure you've seen is that there are some people who would rather not use medications at all. Additionally, parents often inquire and try alternative treatments for ADHD. Many would invest a great deal of money in supplements and therapies without really any evidence for efficacy. For this reason, I became really interested in trying to better serve these children and families. It has been with great interest that I've followed the literature on micronutrients over the past decade. In my practice, as the research basis has become stronger, more patients and parents have elected to try micronutrient therapy as monotherapy or in combination with stimulants. I found in clinical practice that micronutrients are extremely helpful for managing symptoms of irritability and emotional regulation, and help some with focus and attention. In May of 2022, the prestigious Journal of the American Academy of Child and Adolescent Psychiatry published the second randomized controlled trial of broad-spectrum micronutrients for the treatment of ADHD, showing improvement in emotional regulation for those with ADHD. This combination of things have inspired this talk, in which we'll now cover the evidence for broad-spectrum micronutrients, and in part 2, how to use them in clinical practice. Key points. 9.4% of children in the U.S. have been diagnosed with ADHD. Although many children respond to the standard treatments of stimulants and behavioral therapy, approximately 1/3 are still symptomatic even after these treatments. Parents often inquire and try alternative treatments for ADHD, many of which are costly and not evidence-based. There is increasing evidence that supports the use of broad-spectrum micronutrients for the treatment of ADHD.